I'm Lisa Dickmont. I'm the Macmillan Upper GI CNS at Pilgrim Hospital, and I nominated Eileen Daubney, who's one of the volunteers. And she's been working as a volunteer at Pilgrim for the last 11 years. She started volunteering at the age of 76, and she's now 87. And I think if you've been to the chemo suite at Pilgrim, you'll see it is always busy. There's always a lot of people around, feels a bit like pandemonium sometimes. And so in the middle of that crowd, you'll see this tiny little lady who just manages to look over the trolley, walking in and out amongst people, offering tea and coffee, bringing them meals, fetching them if there's something on the trolley. If they want something that's not on the trolley, she goes down to the restaurant to fetch it. Why I actually nominated her was about 5 years ago. We started a support group for upper GI patients, and I was looking for people to help with teas and coffees. And Eileen, without a hesitation, said she would come. And I think in that time she's probably missed one, because she works her holidays round to make sure she can attend that. It's held every 3 months on a Saturday morning, and Eileen arrives about an hour before the people come, so the teas and coffees are all ready. As people come, she's serving them teas and coffees. Throughout the morning, she then takes away the cups, gets them washed up. So after the speaker, she offers everyone a second cup of tea and coffee. And she just does it in such a pleasant, lovely way that it's so life-enhancing having her around. And I often think if we had a little bit more of Eileen Daubney around the world, if we could have like a little essence of Eileen and spray it around the room, the world would be a whole lot of a better place, really.
Hi, my name's Laura White. I'm Head of Nuclear Medicine, and I nominated the radiopharmacy team this year for the Team of the Year. It's a very small team, and they actually provide radiopharmaceuticals for the entire trust every day. Jill Storr, who's the production manager, has been doing it for a very long time and is very dedicated. And to the team, she also, along with Christine, who's the deputy head of production manager, have introduced new schemes in the last few years which have produced quite a lot of savings, including recycling and also efficiencies with splitting the kits between the 3 sites, which has produced quite a lot of savings this year and will continue to do so as we split more kits. And I just want to say thank you for all their hard work and dedication to the patients of ULH.
So my name's Dr. Julia Schofield, and I'm a consultant dermatologist working at ULHT. I work at Grantham in the dermatology outpatient department there, and I have nominated Nurse Tracy Fisher for the Care, Compassion and Dignity Award. I've worked with Tracy for about 7 years in total. She works with me in the dermatology outpatient clinic most weeks, and in addition she runs our phototherapy or light treatment service, where she treats a lot of patients with long-term skin conditions such as psoriasis and eczema. She's a wonderful nurse, and she demonstrates the level of professionalism and caring and compassion which one would hope all nurses would be able to do, but she does it particularly well and works over and above the remit of her roles and responsibilities in terms of looking out for patients. I think one of the really big things she does is she acts as a supreme advocate for patient care. So she will take on board what I've discussed with the patient in the consultation. She will often spend some time with the patient after the consultation, checking that they understand what their diagnosis is, what their management plan is, and also supporting them in taking decisions about their care. And she will challenge decisions that sometimes we make or we try to make for patients. She'll challenge those and come back and say, actually, this patient doesn't understand, doesn't want this, or whatever. So, and that's actually very, very important for us to have somebody standing up for what patients want. So Tracy, I want to thank you. I couldn't do my job without you. You are absolutely outstanding in the work that you do. I want to thank you for supporting so many people in the department, developing other healthcare professionals that have worked alongside you. But most of all, I want to thank you for the marvellous support and care that you give to our patients with skin problems that come to the outpatient department in Grantham.
Hi everyone, my name's Mandy Charles Matron for Medicine and A&E at Grantham. I nominated A&E for their attitudes and behaviours in response to the temporary night hour closure that was in August. It was a big shock to all of us. We were all told at the same time on the same day. So it's a shock to me and certainly a shock to the staff that their department would be temporarily closed. They behaved absolutely 100% professionally. I did a one-to-one with all staff and they all responded in a professional way to ensure that we continue to provide a safe quality service to our patients. They've done really well over the last 6 months in managing this in terms of the change to their hours, their off-duty and the way in which they've responded to the public. I'm very proud of them.
I'm Pamela Beattie, I'm one of the full-time chaplains here at the Lincoln County Hospital, and I nominated Paul Cartwright for a voluntary services award. And the reason I nominated Paul was because Paul is a voluntary chaplain and he volunteers in other departments, but actually in the chaplaincy department it takes a special skill to do spiritual and religious care. And it's not particularly my reflection on Paul, it's the patient experience and it's the feedback we get about Paul. And the feedback has been that he makes a difference to their stay in hospital. And when he prays with them or when he has a chat with them and listens to them, they've found that their well-being has really improved afterwards. So Paul, I wish you good luck tonight and great and thank you for all that you do.
I nominated Helen Jones for the Extra Mile Star Awards because she's been fantastic in rolling out our research database, EDGE, and she's also been really patient training all the delivery team staff, and we'd all like to say thank you. I nominated Dr. Srinivasan for the ULHT Star Awards because of his commitment and support of clinical trials over the past few years. He always has really busy clinics, but if we've got a patient in a trial that needs to be seen, he'll always take time and support us. Thank you very much.
Hello, my name's Jackie David and I'm the Voluntary Service Coordinator at Lincoln County Hospital. I have nominated Paul Cartwright for Volunteer of the Year. The reason I have nominated Paul is I firmly believe he represents everything we look for in a volunteer. Paul works extremely hard, he's committed, he's kind, thoughtful, and nothing is too much trouble. I'd like to say good luck, Paul, and fingers crossed for you. I just want to thank you from the bottom of my heart, and the way of nominating you is to say a big thank you.
Hi, my name is Jacob Hodgkins. I'm the lead site manager for Pilgrim Hospital. I wanted to nominate you guys for this award, the Bravery Award, for all the efforts you did on that Friday, 31st of March. You did a great job that day, everybody thinks so. We really appreciate the efforts you did that day. Really grateful for everything you did. We literally put your lives on the line, trying to help people, trying to save patients, and because of you guys, nobody came to harm whatsoever. We really appreciate that, and I think you're well deserving of this award.